Well, I thought it was only the issue of variants, Brooke, but I'll wing it if there's more. So a lot of news recently about mutants of the virus that are circulating worldwide and finding their way to the United States. Changes in the genetic makeup of these viruses, variants, they're called, are expected, especially with RNA viruses, of which coronavirus is an example. These have been major barriers to effective prevention and treatment for infections like HIV, the AIDS virus, and hepatitis C. Coronaviruses are no exception, but are considerably slower to evolve this way for reasons that are well understood that I'm not going to get into. Perhaps half as fast as the flu, and maybe 1/4 as fast as HIV variants emerge. So since the start of the epidemic, there are thousands of SARS-CoV-2 variants worldwide. This is all totally expected. Obviously, the very large majority of these changes have no measurable effect on how the viruses are transmitted or how sick they make people. There are new variants now, late in the pandemic, from the United Kingdom, South Africa, and Brazil that are causing an enormous amount of both scientific media and population concern. The reason for the concern is primarily because of reasonable evidence, not solid evidence, but very reasonable evidence, that they are transmitted more easily from person to person than what we call the wild type of the virus that has been circulating since spring. Early estimates on this increase in transmissibility are from 1/3 to half more transmissible. And of course, this can make it more difficult to achieve herd immunity if the viruses transmit more easily. These changes in the virus involve a structure called the spike protein, and it's the spike protein that's used in vaccines for one of our key preventive approaches. So whether they will affect vaccines is very important to know. The other issue is whether people infected earlier in the pandemic with wild type strains will be reinfectable by the variants. All this work is ongoing at a feverish pace in public health and academic laboratories, and that data will evolve very quickly over a period of weeks and months. There is no credible evidence yet that any of the variants that are circulating, particularly the 3 that I mentioned, cause more severe disease than wild type. So they look more transmissible. Whether they cause any difference in the disease pattern really isn't clear yet. In the United States, the United Kingdom, Great Britain variant is present in 28 or more states, 28 as of this morning, and I haven't looked since very early to look for other reports. Of some importance, none have been recognized in Iowa, and the laboratory at the State Hygienic Lab is capable of finding those variants. So we haven't seen it yet, and a lot of testing going on at the state lab that I suspect would identify it if it was present. As